Okay. Hi, everyone. Happy Friday to you. It is officially fall here in DC. We are so excited to have you all joining us today for such a special topic. My name is Shonda Cooper. I'm Chief Program Officer here at Tigerlily Foundation. We're just so thankful to have everybody participating in this conversation. Thankful to our patient experts who are also going to be sharing and for those who are going to be a part of this conversation. This is a safe space. It's a place that we come together on a monthly basis to discuss various topics. And this month, we were talking about breast cancer and fertility and the impact that it has on that journey. So with that, I'm going to share a little bit. I've done my introductions. Also going to share a little bit about our 5 agreements. I'm going to introduce our pull up a seat, the reason for why we have it, and then do a presentation on breast cancer and fertility, followed by each one of our phenomenal patient experts. They will each go around and share their stories, especially as it relates to this topic, for about 5 minutes each, and then we will come together with those who are also on the line for a group conversation where we'll exchange ideas on how we can help to share information, how we can also share resources, and answer some questions. And then we'll connect all those together in a few takeaways. Since we are a more intimate group, we're going to have one large meeting instead of it being breakout sessions, and then we'll have some feedback and we'll look at the way forward. Okay. So 5 agreements on how to be in conversation. I'm going to ask everyone to please monitor your airtime, speak your truth, speak from your own experience, lead with curiosity and not judgment, and most importantly, keep this space safe. Our why. Why do we do this? Why are we here? Our why for Tigerlily is to help to educate, advocate, and empower young women before, during, and after breast cancer. This is because of our founding and the reason why Tigerlily was founded, because our founder was diagnosed with breast cancer at the age of 31, triple negative breast cancer, and having to be her own advocate and going through that journey was how Tigerlily really came about. Our why are the women that are on this call. Our why is our angel, one of our angels, Shante Randall, who is no longer physically with us, but her legacy continues through the work that we're doing. And it is through those and those who are on this call that we continue to do this work, because it really helps to change lives. The more we're able to educate one another and create a space for women to have conversations, to be able to share their experiences and resources, we're better together. And each one of us has the power to change something and change somebody within our community. And that is why we believe in the power of one. So pull up a seat and no more disparities. Typically, we have no more disparities prior to pull up a seat. That no more disparities is a unrecorded, unscripted conversation, which this is also unscripted, but that is unrecorded, where we have a space for our Black women to come together to talk about honest topics and conversations. And then pull up a seat is typically between our patient experts, a medical professional, and also healthcare professionals coming together to discuss that conversation about a specific topic. So in this case, it is our topic is fertility. So I wanted to start this conversation since I'm going to be sort of speaking from this and providing some information about fertility preservation. This information is from UMD, MD Anderson Cancer Center, and they provided some of this information to us. Also, we'll be sharing this, and as we continue to talk about this conversation, why it's important. Even though I am not have not gone through, have not been diagnosed or have not had breast cancer, I have had a lot of different women in my life who have been impacted by breast cancer, and also those who have been impacted by fertility. Just on a personal note, I went through fertility preservation a few months ago, and went through that process, and can be able to share that as well as we continue in the conversation about how the egg freezing and going through that with hormones and those different how that is, and the resources and the financial constraints that comes with going through that experience. So as it relates to fertility preservation, it's a type of procedure used to help a person's ability to have children. It's a procedure done before a medical treatment that may cause infertility. So for instance, in this case, we're talking about breast cancer, such as radiation therapy or chemotherapy. Some examples of fertility preservation procedures include sperm banking, egg freezing, in vitro fertilization with embryo freezing, and certain types of surgery as it relates to for cervical and ovarian cancer. Fertility preserving options as it relates to for females include embryo cryopreservation. So that's embryo freezing. It's one of the most common and successful options for preserving a female's fertility. It's first, and how that procedure is done is with a healthcare provider removing eggs from the ovaries. The eggs are then fertilized with sperm from her partner or donor in a lab in a process that's called in vitro fertilization, and that results in embryos which are then frozen and stored for future use. Another kind of preservation is also off-site. I'm pretty sure I didn't pronounce that right, even though it's pronounced there. Site of cryopreservation. This option is a similar process to embryo cryopreservation, except that the unfertilized eggs are frozen and stored. Gonadal shielding. This process is another kind. It's similar to gonadal shielding for men. It's a steps that are taken at aiming rays at a small area or covering the pelvic area with a lead shield to protect the ovaries from radiation. And then ovarian transposition. It's when a healthcare provider performs a minor surgery to move the ovaries and sometimes the fallopian tubes from the area that will receive radiation to an area that will not receive radiation. So for example, that may be relocating it to an area of the abdomen wall that will not receive radiation. I wanted to also, talk about, especially with this on this topic, is oncofertility. And what is oncofertility? Oncofertility experts are those who serve as a bridge between oncology and reproductive medicine. And it's important, for those going through treatment and prior to going through treatment to be able to speak to an oncofertility specialist. I think that's something that we're going to talk about today. And asking some really important questions. Why is it important to talk about fertility preservation before treatment? Patients typically have future family building options before they start treatment. So, for example, if someone's going through chemotherapy, it's a part of their cancer plan to be able to discuss at least egg freezing and sperm banking to see how is that going to be impacted by going through treatment, going through chemotherapy. And it means vast majority of patients, sometimes if they are unable to do that before they started chemo, it can have, it could be too late to start that process. So it's really important as going through that before seeking treatment, before starting that treatment, I should say, depending on where it is, to talk about fertility preservation. And I would love for those women who are on this call to be able to share as well when they share their stories, if that was something that was discussed by their healthcare team as they were starting their treatment, before starting their treatment. So what questions, when it comes to what questions would you ask? What questions will patients be asked when they first meet with an oncofertility specialist? Some of those questions include, what does your future family planning look like? It's helpful to really understand or be able to share some of the knowledge of your family's reproductive history. This is something that we talk about here at Tigerlily, about having the chat. We talk about our family health history in general. And for instance, even with breast cancer, is there someone on your paternal or maternal side that has a history of cancer? Having those conversations, especially within the communities of color, within our community, sometimes it's a little bit hush hush when it comes to that. And especially when it comes to reproductive family health history, that's something that's even, more, it could be really under the rugs, but it's really important to understand that and be able to have that knowledge with you to be able to then share that information with your oncofertility specialist prior to starting your treatment. So that would help with them being able to determine if there are any genetic disorders that might run in your family or infertility. And how they do that is by conducting a baseline fertility assessment to understand a patient's reproductive history and health history. This is usually done by drawing blood and running different labs, as well as doing a test or sort of a sonogram to look and see what's going on, the health of the ovaries. And finding out some additional questions. Has the person attempted pregnancy before? Have they been diagnosed with infertility? Do they have regular menses? If you're meeting with, well, in this instance, this oncofertility specialist she's meeting with a male patient, has any of this led to pregnancy before? And now what should patients ask their oncofertility specialist during their initial appointment? Some of those questions include, how likely is my cancer treatment to impact my fertility? How would we know what is a safe time for me to attempt to have a child in the future? Is it safe for me to have a child in the future? Are there increased risks of health problems in children born from cancer survivors, specifically those who have the type of cancer I have? Are there steps that I can take to protect my fertility during cancer treatment? Now, what fertility testing is available before and after cancer treatment? For women, it's recommended to consider taking a fertility blood test called the anti-Mullerian hormone test, AMH for short, and a baseline ultrasound, which is what I was mentioning earlier, that counts the resting numbers of follicles in the ovaries, called the antral follicle count. These two tests combined can help to give a snapshot of someone's fertility potential, and it provides a comparison after they've completed treatment. Now that I've shared some information with you, and I know that was hopefully I've been a lot to digest, but also I hope it was informative for you. I just want to share with those who are in the chat as we continue on with this conversation. Please feel free to comment in the chat if you have questions, comments, if there's specific questions that you would like to, have answered, or that we can, to the best of our ability. Please write them in, or just if it's something that rings true to you or an experience that you may have had specifically that you'd like to share, please write it in there in the chat. So we are so excited to have 4 phenomenal women with us. Right now, we're still waiting on one of them who is not with us at the moment, but we have Cheryl Stephens, Latoya Cooper, and Jazmine Lampkin with us. Cheryl Stephens is a single parent of a 14-year-old daughter, Amaya. She was diagnosed with ER positive invasive ductal carcinoma in March of 2021. Cheryl, we are so grateful to have you here. I'm not going to share all of your bios because I would love for each one of you to be able to share it in your own voice and in your own story. So as you provide that information. So Cheryl, welcome. Latoya Cooper. Latoya is a confidence coach and a breast cancer survivor. She has helped guide women to challenge their limiting beliefs and work through obstacles, renewing self-love and purpose in their lives. As an under 40 breast cancer survivor, she has been an advocate for preventive care and putting your health first. Latoya, we're so grateful to have you here as well. And Jazmine, last but not least, Jazmine Lampkin, who is a registered nurse, fitness trainer, and a stage 2 TNBC survivor. Welcome to you, Jazmine. Her personal mission is to help young women to feel empowered, informed through about their health through fitness and advocacy. And Shanette, who isn't yet here, but she is a Chicago native, her journey for breast cancer began in 2012 at the age of 33, when she was diagnosed with stage 4 breast cancer. So we look forward to hopefully Shanette joining our ladies on here. So I'm going to stop sharing my screen so we can see their beautiful faces. And I'm going to hand it over to Cheryl to sort of kick us off and share her story. And then I'll ask Latoya, and then lastly, Jazmine. Welcome, Cheryl.
Welcome. Good morning. Good morning, everyone. My name is Cheryl. I am currently living in Dallas, Texas, originally from Louisiana. I was diagnosed with, originally it was stage 1 invasive ductal carcinoma, March 23rd, 2021. And shortly after, when I first had my oncologist appointment, that's when I was told that my cancer was aggressive and it had grown to stage 2. By the time I had my surgeries, I received a double mastectomy. On May 27th, I received a double mastectomy. My port was placed. I received a DIEP flap reconstruction. Shortly after that, I I did 6 months of chemotherapy. After that, after the chemotherapy, that's when I was told that I was going to have to get my ovaries suppressed, and was told that I needed to have a hysterectomy due to the type of breast cancer that I had. So I received my hysterectomy this year in March, followed by my breast revision in March as well. Um, and then I also went through when they went. I'm sorry, you guys. I'm nervous. I never really got a chance to share my story with anybody. So when I went in May to get my port removed, that's when I was told by my breast surgeon that I was developing lymphedema. And it started kind of noticing to me, and my daughter tracks me, I would swell up really bad, but I didn't really know why. Um, so now I'm undergoing lymphedema therapy, and that's where I have to wear a glove and a compression sleeve during the day. And I have to do a lymphatic machine at night and let it run for an hour, as well as the hormonal therapy. And that's the little hormone pill that I have to take every day for the next 10 years until they say otherwise. I also kind of try to find any type of therapies that I can join to kind of I'm still coping. So it's all still brand new. Trying to cope with cancer, the pain that I have every day, the joints and the bone pain, due to the type of medication that I have to take every day. So just trying to find and find resources and engage with other women that has kind of similar stories and has went through things that I went through, who can relate, because a lot of people say they understand, but they really don't, because they've never been in our shoes. They've never had to sit in chemotherapy, or they've never had to undergo so many surgeries and procedures that we've went through, especially at a young age. So I'm glad to be here, and I'm glad to meet other women like myself, and just to learn and engage more and go from there.
Thank you so much, Cheryl. You're incredible.
Thank you.
And you did such a great job. I know they said this is your first time, but it didn't seem that way at all.
Thank you.
We're so grateful for you being here and being able to share your story and creating space for that.
Thank
And
you.
we look forward to continue the conversation, talking
Thank
through
you.
some of what you're experiencing as
Okay.
well, because there are already people in the chat who are already saying like they can relate to what you're talking about. So looking forward to us continuing that as we continue on. So thank you, Cheryl.
Thank you.
Okay, I'm going to ask now Latoya Cooper to please share.
Good morning. Can you hear me? Okay. I'm Latoya Cooper. I live in the Philadelphia area. I want to thank Tigerlily for inviting me to be a part of this conversation. I think it's a much needed conversation and it's very important. I was diagnosed in 2021 with breast cancer. It was aggressive. And prior to starting treatment, I did speak to my doctor, both my husband and I. We spoke to my oncologist about fertility preservation. It was actually brought up at our very first appointment, my initial appointment. It was an emotional experience because, one, after being diagnosed with breast cancer and then also being told from your oncologist, I think she gave me the most honest answer ever. She basically told me, we don't know what chemo will do to your reproductive system, so here are some options for you. So upon hearing that, it was just an emotional roller coaster on top of everything else that was already going on. And I was just grateful that she did give me options. She did explain them. So we did move forward with fertility preservation. It was an emotional journey, just going through the process. I mean, I can say my emotions range from angry at times to just being upset to being joyful. It was just all over the place. I think it was just a combination of everything that was going on at the time, you know, between cancer and then almost feeling like your chances to build a family was being stripped from you. So for my treatment plan, I had chemo, surgery, and radiation. And just like Cheryl mentioned, I was also diagnosed as ER positive. So that involved post-treatment as well. But I'm just thankful to be here. I'm excited, and I believe that we all have a blessed future, and that this important conversation that we're having will help change other people's lives, especially newly diagnosed women, with just letting them know they have a choice. Because that's the one thing it feels like I keep hearing from different stories, women who felt like they didn't have a choice, they weren't informed. So I certainly hope our conversation, us speaking out about our stories, will definitely do that. And the other thing, while I was going through treatment, one of the things I noticed from a lot of women was that when they asked me to share my story, how did I find out that I had breast cancer? And I told them through a self-breast exam. They pretty much said, hey, I don't remember the last time I checked my breast. So from that, I started this initiative called I Love My Breast, which I started with my friends and my family. And it's basically just reminding women every month to just take the time out to just check your breast, you know, 5 minutes, do it while you're in the shower, check your breast while you're in the mirror, as well as while you're lying down. Like, it really doesn't take a lot of time to check up on your health. And I believe that made a difference in me finding a lump and seeking immediate help. So yeah, that's all I share for now, but I'm excited to be a part of this conversation, and I'm just looking forward to it.
Thank you, Latoya. We are so thankful for you being here and sharing your story too. And also just being such a light and being able to also just share about the importance of early prevention, and being able to take the importance of having those self-breast exams and being able to do that, as well as sharing about your oncologist being able to talk about those fertility options, providing that to you and your husband at such an early stage to be able to really have that informed, you know, decision about what you wanted to do moving forward with that. So grateful for you to be being here, being a part of the conversation. And I'm going to pass it over to Jazmine.
Good morning, everyone. I'm Jazmine. I'm from Chicago. I was diagnosed with stage 2 invasive ductal cell carcinoma, October of 2021 at the age of 29. I went through 6 months of chemotherapy, followed by a lumpectomy and radiation, as well as immunotherapy. I'm actually still on immunotherapy. But I am on the road to survivorship and recovery. And I'm so excited to be here and share my story alongside some other beautiful survivors or surthrivers. I love that. I did go through fertility preservation. The only thing is I did not know that breast cancer treatment affects your fertility. So I actually have a close friend who went through breast cancer treatment who told me right at the beginning to make sure I ask these specific questions. So I actually brought it up to my oncologist because my stage of my cancer was so aggressive. She was just like, we got to get started, you know, right away. And I'm like, hold on, wait. You know, I'm 29. I do have one child already, but I want the option to have more kids in the future. So once we talked about that, I went through the process. It was very tedious. I had no idea that I would have to go into the clinic so often. It went from like every other day to every day towards the end, getting closer to the surgery. I had to inject myself with hormones. Luckily, I'm a nurse, so that part wasn't like too scary, but it was still, I've never injected myself with anything. So going through all the emotions, like Latoya said, it was just hard. Like first being diagnosed and then being faced with something, almost a whole nother diagnosis, like possible infertility, and not even knowing that that's even a thing. I didn't know that breast cancer treatment even affected your fertility. So, yeah, I went through all of that. Still, like I said, still in treatment, and just trying to rebuild, get my life back, and learn as much as I possibly can about breast cancer, connect with other women. It does help a lot to just talk to other women who have gone through it, who are going through it. So I'm just happy to be here. I'm excited. And I want to thank you all for being here. And I want to thank the other Surthrivers for sharing your stories. And yeah, I'm excited about this. This is good. We need to continue to spread the word. Not a lot of people still don't think that, breast cancer is a thing under 40. And it is. Like, we're constantly, finding more and more young women affected by it. I was 29, no family history, in great health, and still was affected by it. So I just want to do my part in spreading the word and pushing self breast exams and just promoting health in every aspect.
Thank you, Jazmine. Yes, absolutely. 100%. No family health history, and being able to just, like you said, spread awareness, to be here, especially at you're 29 years old, and continuing as you continue on with that treatment. And also having, like you said, I mean, being diagnosed with breast cancer, and then also sort of feeling like you had a double diagnosis as well. That's something that, that isn't really talked about. And then on top of it, being a registered nurse is like, you're aware, you're on both sides. Like, you've had that experience dealing with patients, and now here you are receiving that assistance too, and being on the other side. So being able to sort of, that duality of it too is really something that I'm sure is pretty unique because of, your health, about your medical background. So, thank you for being here and being a part of this conversation as we continue to talk with the rest of the ladies that are here, about this and many more, about how we can continue to raise awareness. I am going to pass it over to Shanette. Shanette, we're so excited to have you on and to be a part of this conversation. Please share with us your story, and after that, we'll open up our conversation.
Sure. Good morning, ladies. I'm happy to see you guys virtually this morning. I'm happy to be a part of the platform. And my story began with breast cancer almost 10 years ago, actually a stage 4 diagnosis. I was in my early 30s when I was diagnosed. And like most of the ladies here, no family history. So went into the doctor believing I was going to have a cyst removed, and found out I had, it was cancer. And not only was it cancer, it was stage 4. So because I was diagnosed with stage 4, it was kind of a sense of urgency to get moving and to get things done, because it had already spread to my liver and to my spine as well. So when you're first diagnosed and you're going through the motions, you have a lot of questions, but it's sort of a blind area where you really don't know what to ask, what to say, because you're so in that moment. So you only think about right then and there, am I gonna survive? That's the only thing, like, how do I get through this? You don't think about the fertility. You don't think about anything like that, such as survival. I mean, the only thing you think about is surviving. And unfortunately, it's a lot of things that's not discussed in the beginning that I believe should be discussed, because it could help you decide the outcome, or the trial, what you want to take to kind of get through it, versus the doctor letting you know. I think it allows you to have more decision making in the process, such as if you are young and you do want to have your eggs frozen, or you do want to have a chance to get pregnant later in the process. I believe all those options should be presented. But again, because we're so unaware, in which I was completely unaware, it's just about kind of getting through it at that time. So here I am now, 10 years out, and I have kids. I have 2 boys actually, but I'm at a point now whereas I actually don't know if I can conceive or not, because I was diagnosed with HER2 positive. And then I had a second diagnosis, which was ER positive, which the doctor found to be uncommon to have one type of breast cancer, then for another type to come back in the other breast. So with the ER positive, I started having to get the hormone injections. Lupron, I think is what it's called, but I had to stop that because it sent me into a really deep depression. So after stopping that, I've been on Herceptin for the last 5 or 6 years, and I recently just stopped that. But through this process, I still never questioned about fertility or having kids, because my mind was only just getting through the process. But here I am now, and just wondering if I can conceive or even get pregnant. So now we run blood tests just to kind of see, and it shows that I'm ovulating, but it's at a very low level. But to me, it's still trying to understand and trying to figure it out. So, from the beginning, we don't think about that because it's the last thing on our mind, and our doctors don't tell us about that because I'm sure it's the furthest thing from their mind. And then because they're oncologists, I believe they don't always know when it comes to certain part. They only know their part and what they're supposed to treat. So it's kind of about asking those questions, but then, like I say, you're so caught in the moment. So I guess that's when our friends and family or people we know can come into the background and help us with those type of questions and kind of getting through it.
Definitely, yes. Oh, are you still there?
Yes.
Okay, all right, great. Yes, absolutely, Shanette, thank you. There are so many people writing in the comments too about just what you're sharing, and for being able to just be open and being here with us, especially, and you really hit something that struck a lot of people as well, which is, I mean, the sense of urgency. You're getting something, a life-altering, life-changing diagnosis, and at the same time, but your mind immediately goes to in survival mode, and being able to have that support to be able to help you to go through and determine those different options that you have. That's it's a really important point that you raised. So I am going to bring in all of our different our patient experts on together to discuss and have a conversation. Like I said, anyone who's on in the chat as well, and if you'd like to ask a question or discuss with these phenomenal women any of their stories or some of the information that they shared, please write it in the comments or please raise your hand. I'm also going to kick us off with a few questions and we'll sort of take it from there. So as we start, just to kick off, and I think that there were a lot of topics that we can discuss here. I think one was, we were talking about the sense of urgency. But when we look at that, and I want to, sort of hear from all of the panelists that are on and those who are in the chat too, and those who are also going through this, like Shanette said, were you aware of all of your treatment options? And did that include fertility preservation? Was that made known to you at the beginning of when you were given your diagnosis?
I'll go ahead and start. For me, it was made known to me at the beginning, at the initial appointment. My husband and I were prepared to ask about it. It was one of the questions. I'll start back. So my nurse navigator played a very important role after I received the diagnosis. She was the very first person to call me. And she told me to make sure I have a notebook because there were going to be a lot of information. She told me just prepare for the appointment by writing down any question, whatever we could think of, just write it down and just ask. And that was one of the questions that we had, was regarding fertility. So when I went to my initial appointment, we asked the question, but my oncologist was prepared as well, because she said that was on my list also after giving me the diagnosis, because they actually ran through the grade and the stage of the cancer in more detail when I went to my initial appointment. They didn't tell me that over the phone. So she actually was prepared, she said, I looked at your age, I looked at your chart. So I was prepared to discuss what options was available. She also provided recommendations as well. So she certainly was prepared to share that information with us at my initial appointment.
Thanks, Latoya, for sharing that. And that's, I think you highlighted something too, the nurse navigator, and having that person to also be able to guide you or be able to just say to write everything down, write all your questions down, and continue to do that, to be able to be advised on what to do, to have that conversation and to be able to have some clarity. Because even with something like this, the more that you're aware and of all the different pieces, the more empowered you feel to be able to make those informed decisions. Anyone else? How was your, how was it when you received that information? Did they provide all those, the different treatment options to you? Yeah, Jazmine.
So like I said before, my doctor didn't bring it up initially. There was like this sense of urgency, of course, because my cancer was so aggressive to just go ahead and start treatment. But I thank God for my friends. One of my friends is on the chat today, Rachel. She's a 2 times breast cancer survivor. And I just felt equipped after talking with her, because this is my first time going through this. Even though I'm a nurse, I'm not an oncology nurse. So I don't know, all of the ins and outs. So just having a support person there to kind of guide you, because I'm going to be honest, going through this process, I'm a little bit disappointed in the healthcare system and the amount of information that they don't share with patients. I understand because of the urgency of getting treatment started, but when you're talking to someone in their 20s, 30s, or someone who's never had children, it's like top of the list important. Like it's priority to me. So in my personal experience, I have an amazing oncologist and oncology team. However, I had to be the one to bring that topic up in conversation. Once I brought it up, she was right on board. She sent me to where I needed to go and everything. But had I not had that friend and that support system, who knows? I would have probably just started treatment and later found out, oh, my fertility is affected. So support systems are very important. And that's another reason why I decided to join Tigerlily Foundation, just to spread the word, because a lot of people don't know. Most people don't know.
Absolutely. Yes, absolutely. We're so glad that you are, and thankful, to be able to express it to and release it, because it's really, to be able to have to do that on top of what you're already going through, especially as Black women, where we do have to advocate for ourselves all the time and having to push and fight. And on top of that, you're fighting for your life. And then you're also having to advocate on top of that to say, hey, this is what I need. I want you to answer these questions. Like you said, you're in your childbearing years, and being able to have that question be addressed is critical. It's very important to just ask you, just to provide it as an option. I don't know if Shanette and Shanette and Cheryl wanted to chime in before we move on to another question.
I can say that when I first was diagnosed, it was never mentioned to me. It was never brought up. However, I never really asked because I was just in survivor mode. I just wanted to, go ahead and get the process, the treatment going, because I wanted to live. I wanted to just go ahead and beat, what was in stake for me. But when it got to the point when after I finished treatment, that's when it all started to kind of hit. They never asked. And I think it was partially because I'd already received a partial hysterectomy, but I still had my ovaries. So I still had a chance of, possibly, maybe having a surrogate, having a chance to still have someone to, give me a child. So once the hysterectomy came And, the Lupron injections and all that, that's when it kind of hit like, dang, I was never given that option. I was never told, that it's even possible, that there's a chance that I can still, possibly conceive another, well, not me personally, but have another baby. Now I'm 34 in menopause. So it's like, what are the chances? Like, are there even any other options? Now I'm literally 34 in menopause with all of my options being taken away from me due to cancer.
Yeah. Yeah, Cheryl, that really is, it's the being able to, going through this and feeling that, like you said, it's something's been taken away from you. And you didn't have because you were in that state, not being able to speak about it or be able to say, this is what what I can do about, trying to look into those options. And I believe that there are some options too that, even post now that, whether it is, somebody donating an egg or donating those different things to try to be able to see what can be done in that space too. So I wanted to pass it on to Shanette too. I see that you're unmuted. If you wanted to share as well.
Yeah, I agree with all of what the ladies have said. And then I think my oncology team, they're absolutely phenomenal. Like Cheryl said, I wasn't given as much information as I should have been given in the beginning, but I believe it was just out of a sense of urgency. But I've also learned when it comes to our doctors and our oncologists, sometimes if we don't ask the questions, they're not going to tell us. It's not because they don't want to tell us, it's because we're not asking the correct questions, or the questions that we really want to know the answers to. So, outside of fertility, as far as like sexually, things have changed from that point of view too. And that's something that's not really discussed. So, in the back of my mind, I'm thinking, do I need to see my gynae doctor for this so I can continue to see my oncologist? So what other steps or what other type of physicians needs to be brought into on our cases when we're dealing with cancers outside of who we see, outside of the surgeon and the breast doctor and the oncologist, like just the complete team to help you deal with everything, every aspect of cancer and not just the tumors itself.
Absolutely. And that really really that ties in exactly to what I was about to talk about, which is the emotional toll, the emotional part that goes into this. And like you said, having to ask these questions, having to do all of this, and the emotional effects that has on you and being able to be provided that, like you were talking about, even your, when it comes to just having sex and those experiences there and how that is impacted and affected by, going through treatment. That's something else that isn't discussed. So I'm also curious, how have you been dealing with this emotionally? I know that some people, have some support systems. Have you, talked to a professional about it? How have you been sort of trying to cope and maneuver through these different seasons?
I'll start. So one thing that was offered to me was a counselor. So I started to talk with her at the very beginning, and just like we would just do like weekly check-ins, and she offered a lot of emotional support and like coping mechanisms. So talking to her as well as my family and friends helped a lot, because emotionally in the very beginning, man, the depression was like really, really deep. Just not knowing, that the fear of the unknown, like, am I gonna live? Like that, it's like you grieve your own self, but you're still here, if that makes any sense at all. So like I was literally grieving, and for a long time. So I strongly recommend anybody newly diagnosed with cancer to seek professional help. Even if you don't feel like you need it, just to make sure, because a lot of times we're so distracted with everything that's going on, like physically, we kind of like shy away from the mental aspect, especially being women, especially being Black women. We are always expected to be strong. You know, we strong, we got this, we can do anything. But the truth is, sometimes we need help too, so personally, I was speaking with a therapist throughout the journey, as well as family and friends and my support system. So that's how I wouldn't even say got through it, because I'm still getting through it. I would say that's how I'm still getting through it.
I can also relate to Jazmine. While I was going through treatment, I didn't really have time to. I really didn't focus on my emotions. I just wanted to just get it over with. And once my treatment ended and I had my hysterectomy, that's when everything just kind of hit me at once. I was able to kind of reflect on the last 9 months that I just went through, the pain, like the way my body looks, like everything just started hitting me at once, and I didn't understand it. It was more so, it started to turn into anger, like why me? Like why did I have to why did I have to go through all of this? So eventually I joined a coping with cancer group, and it did help. Just like now, relating with other women that's going through the same thing or has went through the same thing, that understands. Like we can sit up and talk about Lupron, and we can all relate to something. So it helped, and I'm still coping. Just a everyday. Some days, like someone mentioned, some days I can't even get out of bed because of my bones hurting. So it's emotional being 34 with a child. Some days I'm crying and angry and I don't know why, because I'm, dealing with hormones that I no longer have, and I'm on medication. And so it's like it's a everyday, thing, just dealing with the whole process. But we'll all get through it, with the support from each other, family, and the friends that we have.
I agree. It is very emotional, and to me, 10 years out, I'm still dealing with it. And for me, the emotional scars actually cut deeper than the cancer itself, because the cancer can leave your body, for some, but that just emotional part, the fear, it sticks with you. And my cancer anniversary is October, and the month of October, I'm just in a mood where I'm not always happy, because I feel like I'm constantly reminded every day, when this is my life. My life is more than 30 days. I have to wake up every day and survive and mentally deal with what I've been through. I have to look at, the scars. I lost my hair and it never came back. And I think I had a little alopecia going on too, but just there, it's, when we look at ourselves, we know it's different, and it's not the same, and it never will be the same. So imagine you have to deal with that every day. The physical part of it never leaves you. The emotional part of it never leaves you. And it's really hard to cope with it. So I do have support groups I'm a part of. I've never done the one-on-one therapy, because for me, it's just more important to relate to people as far as therapy who knows what it's like. I feel like they can offer kind of the best emotional tools to help me kind of get through. And it's been helping me a lot, not only in dealing with the emotional scars of cancer, but just dealing with the emotional part of life that I go through.
And I can relate to all the ladies on the panel as well. For me, I have an amazing support system from my family and my friends. My husband, he's amazing. And I actually, even going through the journey, it was one of those times where I was able to be vulnerable and transparent without feeling like, someone that has a Me Too situation. I was able to call anyone in my support system and actually just tell them how I was feeling, what I was going through. And they just listened. And that meant so much to me, especially when you're a person who is the go-to person for everyone else. So that helped out a lot. Connecting with other women throughout their journey. I just remember going to treatment, and when you're in treatment, although you may not talk to people beside you, but just seeing them there, and every once in a while saying hi, that worked, and we end up exchanging phone numbers and connecting. So it was all about like that relationship. I didn't really join any support groups at the time because at the beginning it was very overwhelming for me. And it was like information was coming from everywhere, and I just needed to dissect and understand what was going on without everyone pouring everything into me at once. So now I just, I speak out whenever I can. I don't mind sharing my story. I don't mind being vulnerable and just transparent because I know lives can be changed. And I would, looking at it from the other perspective, if I was in, on the outside looking in, I would want someone to share their story with me as well. But I do agree that counseling is helpful. I remember getting counseling prior to even being diagnosed with breast cancer, just to deal with some traumas. And I think that helped me a lot to get through the diagnosis when it did happen. Not that I was expecting it to happen, but it was, it helped me to get through that phase of going through another piece of trauma in my life, but this time from a health perspective.
Absolutely. Absolutely. Thank you, ladies, for sharing that too. And yeah, I see Marika's putting in the comments that even survivors can seek counseling too, because to your point, it's even though it's over, well, even if you are a survivor, it isn't over. There are lasting side effects, there are changes, like there are scars, there are your life is never the same as to what it was before. You have a new life. And like Jazmine was really saying, you're grieving that. You're grieving what was and what is and the unknown. And that is also anxiety. There's a lot of anxiety around that. There's a lot of anxiety around the unknown and thinking about the future, but also trying to be present. It's, so dealing with all of those and being able to have that counseling and that support and is really important. And here as Tigerlily, like that's a part of it, being able to have support and for you all to be a part of this group. You're part of this pull up a seat family of support of other women who have something in common that you all share, that you can be able to talk to each other and be there for each other. And like Latoya was saying, just to pick up the phone, a lot of times, especially as Black women, we are looked upon as the go-to. And I would say that with that too, it's being placed in my heart to also just say to have grace with yourself, like have grace, there's so much that, we reflect or think about, okay, this is something that I could have done. I should have asked that question to the doctor. I should have asked about, this different treatment and those different things and that brings up a lot, and I think when we were talking about healing and trauma, that is a part of a trauma being, especially with someone, not receiving the information when it came to for your fertility options and not having that option. And reflecting on it, like Cheryl was saying, like, it hitting her all at once because all these things happen and here it is now, and addressing that and having to heal and unpack what that means. It's really, it's definitely like, a sort of PTSD. I see Shanette saying in the chat. And so I just wanted to share that with you all too, is, to have grace and with yourselves as you continue to heal. And it's okay to feel whatever you're feeling at any given moment. It's okay. It's okay to be angry. It's okay to, to grieve. It's okay to, to celebrate the little joys of literally, if it's just getting out of the bed, that is a win. And to be thankful in those moments, trying to find those pockets as you continue on and as you continue navigating this, and then being able to then just be real. And like you said, you aren't, be real with it, that this is just what it is. This is where I am today. I'm not feeling it. I'm just here. And to each one of you, you showed up today, despite whatever was going on. You showed up for yourself, first of all, and then you showed up for others. And that is to be commended, to open up and to be able to share something that's so personal and to create space, because that shows so much about your heart and your willingness to be able to provide that information to others. It's really a blessing. And I just wanted to thank you all for that. I guess, when we're talking, I guess it's a little bit, again, tied to the emotional part, but in a way, I think we started to talk a little bit, it was in the chat, there was some camaraderie around it, and it's taking these, having to take hormones and taking those injections and that emotional roller coaster. Because it's one thing going through an emotional roller coaster is different when you're literally having to inject yourself, first that process of having to inject yourself, and then going through that, and the effects of that has on your body during that time. You know, I don't know if anyone wanted to sort of touch on that a little bit more for those who have gone through that, or even had, I think almost most people, I think several of you have on the call have had to deal with those injections or having to take them, whether it's a few times or, you know, for extended periods of time. You know, just how that has been for you. And also how you've been able to sort of, I don't know if you have any sort of cheat codes too, like having, especially with loop, you know, taking some of these shots, where do you, and placing them in different places? Do you have any, you know, suggestions, recommendations, like, oh, I know when you're doing for the fertility preservation, there's certain places that you're supposed to place it, but also sometimes you can put ice, or you try to do something to maybe make it not as achy. I was just curious if there's any, you know, advice or anything that you wanted to share as related to that emotional journey of going on that, and also having to inject yourself in general.
I'll go. I really don't have too many tips. The ice is a good one to kind of numb the area before you inject. Sorry about that. And then I gave myself injections at the bottom of my stomach. So that's like the fattiest part of your body. And it usually hurts less in fattier areas. And with the Lupron, they did it at the clinic, and they would always do it. They asked me that I wanted in my arm or my butt, and I always chose my butt because again, another fattier area of my body. So I hope that helps anybody who has to take hormone injections. Another thing I wanted to touch on with the hormones and emotions. For me, I experienced a lot of weight gain. That was very difficult for me, still difficult for me, because last year I became a certified personal trainer. So I was in like tip-top shape. I had lost all this weight and, you know, feeling really good about myself before my diagnosis. And now I'm like, you know, gaining weight, even though I'm trying not to. I'm making a conscious effort to eat healthy and exercise, and I'm still gaining weight. So it's like there's a physical aspect that's also tied to an emotional aspect as well. And the hormones make you have crazy emotions too, like mood swings, hot flashes. Hot flashes just make you mad. So just dealing with that. I know that a friend of mine told me that vitamin E supplements help with hot flashes. So I was taking them, and I think they did help. They didn't like take it away, but it did help a little bit. So I'm hoping that that helps somebody.
Definitely. Anybody else?
For me, it was the Lupron that put me into a very bad depression. So I think it's important that we take notice of the changes that's happening to us mentally as we're taking any med. And I didn't know that it was the Lupron that was doing it until I went to my oncologist and I let her know the symptoms and what was going on with me. And she knew me as being kind of, you know, a person that's always going, that's positive. And I just told her it had me disengaged. Like I didn't want to be around people. I was just sad all the time. And I couldn't move away from it. So just for me being aware, but not knowing what it was. So it's about just being aware of the different things that we take. And even with the tamoxifen, it was the same thing. It was just different things that I felt that was going on and stuff that I couldn't control, and I didn't know what to do about it. So that was the only thing, besides that and the tamoxifen, that was the only thing that really affected me from that standpoint.
Yeah, I just wanted, you know, those are such great points. And when y'all were talking about that and talking about the hormonal side effects that, you know, some of these treatments take, it made me just think about and wanted to raise while we're on this about the importance of clinical trials too, and the importance of representation. And I know when we talk about clinical trials, there are a lot of different there may be stigmas around clinical trials, and especially within our community, given some of the history of medical racism that has happened in this country. Also, being able to be a part of these trials helps for for our data to be represented, and to see that is there a difference? Is depression higher as it relates in Black women with the certain, treatments as it relates to others, for other diagnoses, to be able to then say, for a doctor to say, okay, this one may have an adverse effect. Why don't you try this one? But if we aren't in those trials, then our data literally our cells aren't a part of that. And then we're getting, given treatment, and we're giving medication that are having different side effects to us than it would, a white woman or another person of color. So I just wanted to share that too, as we continue on, and even with those who are, survivors, or those who are continuing to go through treatment, depending on what it is, if that's something that you are interested in or just want to learn more about when it comes to clinical trials, we'd be happy to share that with you. As it relates to, we have a clinical trials program to be able to just provide that information, or to just sort of give you, if you have questions about it. It just came to mind when you were saying that, Shanette, and you all were talking about, like I was seeing in the chat, weight gain, and some of these other hormonal side effects that are taking place, that this is another way that we as a community, because it's also, yes, we want to talk about some of the challenges that we're facing, but we want to talk about what we can do and how we can be empowered, and how can we help our sisters and our brothers, like those who are going to, going through this, how can we help to save lives? And it's part of it is speaking up. It's also part of it is, trying to act as well if we can, what's in our control, and where we are, if we're in a space to be able to do that is really important. Carla was saying in there too about cannabis and the health benefits of that, and how that's really helping her with her journey. I see also ginger in here for anti-inflammation, turmeric as another one. It's the turmeric, it's the curcumin one. I've seen that before too. Probiotics for depression. So like I think Carla said, it's cannabis is God's plant. It's, trying to see what we can to get from the earth as well, but also there's a medication that can help as well in some of these things. So it's trying to find that balance where possible to be able to do those things, and see what works best for you, because each one of us are different. Each one of us are going through it in a different way, and it's having a different impact on our bodies. But I think to Shanette's point, and what Latoya was saying about making sure to keep those notes so that you can then be able to monitor your body, monitor those changes, and then be able to say, okay, I noticed that every time I'm taking this medication, X amount of days later, I'm feeling this way. I'm not feeling so good. I'm feeling down, or whatever it is. So those are just some important, takeaways, or just some thoughts I wanted to share with you ladies too, as we continue on this conversation. Okay, so another area that I wanted to talk a little bit about too, when it comes to this, we talk about fertility preservation, is the cost. Because it isn't cheap, and I wanted to hear, for those who have, gone through that or even explored the options, was there any financial support that was provided to you, or what financial resources, if any? How did you sort of navigate that on top of the other costs that you're already having to deal with?
So I'll start. The cost, it was extremely expensive. There were programs available or out there, but you had to qualify for them. And I'll share it. Each no I received just made it hard. Like usually I can roll with the no and be okay with it and maneuver my way around it. But for some reason, each time we received a no, it just brought on more emotion. And like I said, every program had their own qualifying options available. The cost was very expensive. It was something that played over and over in my mind, because I'm thinking, okay, we have the cost of this, and then the what ifs, we do, what if we don't? And then I still have to face this treatment and the cost of that. My insurance didn't cover anything when it came to the fertility treatment. So I don't want to say it was a big sticker shock. It was just one of those things that was unexpected based on everything else that was going on. So I can't think of anything else right now, but
Yeah.
something else will come to me. But it was very, I don't want to say shocking, but it was a hard pill to swallow with everything else going on in terms of.
Yeah. Anybody else with that, in terms of the cost, and how to sort of navigate that?
I'll
If there's any
share.
options.
So I was offered like an option. Well, I'll just say this. They had a program for people if they fell below a certain income level. And obviously I had to quit my job because I was getting ready to go through chemotherapy. There's no way I was working in a hospital going through chemotherapy. So luckily we fell beneath that income level. So they covered almost all of the costs. I did have to come out of pocket for some of the medications, but I remember looking at that sheet and I'll never forget, like the, not the surgery, but like the blood draws and the ultrasounds and stuff, that alone was $6,000. Then the medications alone was $11,000. And I was just thinking to myself, this is crazy. Like, what about people who can't afford this? Like, does this just not become an option? And not even for breast cancer patients, but just people who struggle with infertility. Like, I always heard how expensive it was, but to see those figures, I was just like mind blown. And I know that a lot of insurance companies don't cover, well, I've heard that a lot of insurance companies don't cover that. So yeah, that was crazy. I was lucky enough to get help with that. But yeah, like Latoya was saying, if you don't fall below a certain income level, some of those options aren't even available to you. And then you're stuck. Like, what do? I still got to pay my bills. I still got to eat every day. I still have to survive. So I'm hoping that they do come up with more like programs that are available to people, because it's insane.
Yeah.
Yeah, and I wanted to share, you mentioned about programs. There are programs available that for the medication, to help cover some of the medication, but again, you still have to apply for them. You still have to qualify for them, because I remember the facilities sharing that information with us. So you still have to, do the application process, and it was specifically for patients who were diagnosed with breast cancer. But again, you still got to qualify. So that's the big piece, is qualifying, knowing about it, getting the information, and then qualifying for it. And the criteria was different for each across the board, because it was several types of medication I know I had to take for the procedure.
Yeah, absolutely. Those are, and I think we'll look into sharing some of those resources as well with you after post call, to be able to send some of those resources for those who might be on and might be interested in just being able to see that. Part of this is to be able to be informed and be able to share that information with others. And depending on where you live, there are different options as well for that. I wanted to open it up to our panelists if they have questions or something they wanted to share or comment for the rest of the group, or those who are in the chat, if there was something as well that they wanted to share. So I'm going to pause for a little, give you all space to, raise your hand or, unmute yourself. Okay, so y'all don't have to all jump out at once, so it's okay. Totally understand. So keep thinking about it, but yeah, one of the questions, I have a bunch of questions, so I just want to give space for others to be able to ask as well. And again, as we continue on, if you do have additional questions, feel free to, chime in about that. Oh, that's really great, Carla. Carla was talking about, she said she was double covered with her insurance and the program that she took if she was in California. So that's really good to know. And Cheryl, thank you for sharing that too about Dallas. This is the reason why we have these conversations, is that we can be able to at least plug in with one another, depending on where we are. to be able to share what is available and being able to provide that research and that information to one another. I was curious if anybody has, so for those who may have already gone through the journey or are thinking about, have undergone either fertility preservation or thinking about it. I'm sorry, this is specifically for those who have gone through the fertility preservation. Have you gone through the process of trying to unthaw any of your eggs or are you still, just holding off, but you know that you have that option? I'm just curious.
No, I haven't started the process of unthawing. I actually was in post-treatment for the first few months of the year to see how that went. But yeah, I hope, look, I'm not gonna say I hope. Yeah, I hope to come back with a success story, but at the same time, I feel like I know I'll be back with a success story. So I'm excited once the process starts and we move forward. I actually still want to conceive naturally, that's my goal, but at the same time, I still have the embryos. So
okay. Oh, Jazmine, yeah, go ahead.
Same for me. I haven't started. I'm actually still on immunotherapy, and I won't be done until December. So I don't have a plan, like, we don't have like a set date or anything when we want to try, but like Latoya said, I do want to try to conceive naturally first. And then, if that doesn't work, then I'll tap into my little bank over there. But but I'm very happy and thankful that I do have that option. But yeah, no, I have not tried yet. I'm hoping and praying that I can go ahead and conceive naturally. But yeah, still in treatment, unfortunately.
Yes, and that should, that's your focus. That should be, your priority. And for those who are on to who who have had to have already undergone hysterectomies or have already received those diagnoses, of infertility, where there's so many different options and so many different ways to continue to have hope and to continue to know that there are different ways to have that, like, to create that family that you would like to have, if that's something that you're interested in doing, whether it's through, like I was mentioning, there are egg donations. There are different ways that people are donating embryo. There are, surrogacy. There are a lot of, different ways to be able to do that. And I think possibly we need to also even sort of challenge or try to see how those things can be covered as well. Because the cost of even just of doing, I guess, what would be considered sort of the standard forms of fertility preservation are also really high. So when we look at some of these other options, seeing what can be covered and how we can get that, because it's so important to have that hope and also to be able to know that this is something that's possible, because of those who have been diagnosed at such a younger age and during their childbearing years, to be able to have that option. Based off to be able to continue to have that family that they would desire. So I just wanted to share that too, for those who have been further along in the process or, have made those decisions, that there's still options, there's still ways to be able to continue to try to seek that and to get, what it is that you're looking for in that sense. I just wanted to encourage those too who may not have received those options earlier on in their treatment. Or are still going through treatment at this time. I know we have about a few minutes left. So I, again, wanted to open it up to see if anyone wanted to say anything. If not, I would love for each one of our panelists, our patient experts, to be able to, go around and just share if there's something that you wanted to leave with the audience, if there's something that you want to, that's on your heart that you want to share with them. And it can be anything, a word of wisdom and encouragement, or whatever it is that's placed on your heart that you want to share and leave them with, as each one of you do have the power to create change, and your voice is important. It matters. God has placed you on this earth for a reason. even throughout all of this, your voice and your power to speak. There'll never be someone like you that has that voice ever again in history. And there's so much power in speech, and your ability to be able to share that. And there's no pressure as well into trying to say something profound. It could just literally be like, go get it. Like, it doesn't have to be anything it's whatever's on your heart. But I wanted to give you all that opportunity to be able to, if you have something that you wanted to leave as a lasting takeaway for those who are on. So, what would you like to leave them with? And feel free to just go around. I won't, call out each one person at a time, but you all go ahead and when you're moved, unmute yourself.
So I'll share. Thank you all for being on this panel. Like, I'm grateful just to be a part of the stories and just to hear everyone and how you courageously fought your battle and you're still fighting for other women. And I just wanted to share for anyone newly diagnosed or someone newly diagnosed, just know that you have options. And that's with fertility. That's when it comes to your cancer treatment. You have options and you are the most important person when it comes to making a decision. Also, make sure you have an advocate with you. Just have someone that can be that voice of reason, because as we all shared, the process is emotional. And for someone to bear it on their own, it's hard. So definitely, if you can, make sure you have an advocate with you, and know that it's okay to feel whatever you're feeling in the moment. That was something that I know I had to learn and release it and let it out, because it's going to do more damage holding it in. And you already have to go through enough when you go through the journey. There's so much you go through, whether you're having chemo, surgery, whatever your journey consists of, there's so much. So definitely release it and just take the time. Even now for me, I still check my breasts, just because you're diagnosed, as we see, there's women on the line who have been diagnosed more than once, so make sure you continue to check your breasts, check up on your health. And as Shonda said, certainly give yourself grace. So I love each one of y'all. I'm grateful, like I said, to be a part of this panel, and thank you for inviting me to have this conversation.
Thank you, Latoya. Thank you so much for that.
I'll go next. Thank you guys for joining us this morning, and thank you, Tigerlily Foundation, for allowing us to be a voice for the foundation. And what I've learned through my diagnosis is actually it's weird, because now I feel like it wasn't for me. It was for me to be sitting here and having the opportunity to speak to you all and share the experience of what I've been through with as many people as possible, to let people see who I am and to know who I am, and to know, like, through my uncertainty of cancer, or through anyone uncertainty of cancer, it becomes a new possibility that anything is possible. Out of the worst situations comes the best outcome sometimes. And that's been the biggest lesson I've learned through going through this. Like Latoya just said, allow yourself grace, allow yourself to be okay. And sometimes it's not going to be okay, but just don't sit in it too long. If you feel like you're there too long, reach out to someone, because you're never alone. There's always outlets, there's always friends, there's always family, there's us. Just never sit in it too long, and allow yourself the grace to go through and feel how you want to feel, and just try your hardest to get through it, because you're definitely not fighting alone.
So good. You are not fighting alone. Thank you for that, Shanette. So true.
I'll go. Again, thank you all for joining us, and thank you, Tigerlily Foundation, for having us and allowing us to use our voices and share our stories. And I just want to say, a friend of mine told me when I first got diagnosed, keep your mental health in order, because whatever you think, your body will follow. So whatever you have to do to keep your mind where it needs to be going through this journey, or any traumatic process, do what needs to be done, whether that's counseling, I don't care if it's medication, whatever. I learned that early on, like, I have to keep my mind, I have to stay focused, and I have to keep my mind in the space that it needs to be so that my body can stay strong and fight through this. And to piggyback off what the other lady said, Shanette and Latoya, give yourself grace. I'm still struggling with that, especially just accepting my new physical appearance. My husband gets on me all the time. He's like, you are fighting cancer. And I'm like, but I am still human, and I'm still a woman, and I still, want to be desired, and, but you're never alone. We're always here. I'm so, so thankful and so, so grateful for the Tigerlily Foundation and my new sisters that I've acquired. I'm just grateful that I always have somebody to call on. So thank you so much.
Thank you, Jazmine. Thank you for sharing that too. Yes, keep your mind in the space it needs to be, and having a space where you can also know that you aren't alone and that you have someone to reach out to. We're so thankful that you're part of this sisterhood as well, and to be able to be a voice and to be on today. Thank you so much. And Cheryl.
I just want to say thank you for allowing us to come on this platform and share our stories, allowing us to meet other women like ourselves, to develop new friendships, new relationships with each other. Like everyone said, like cancer does not define us. Peace, like Jazmine just said, peace. Your mental is stronger than your physical. Like Latoya just said, just having someone we can relate to. So I look forward to whatever's in store for all of us, the relationships that's gonna take place from this day forward. And we got this, like we got it.
Yes, we got this. Yes. Claiming that we do. Thank you so much, Cheryl. Thank you, Jazmine and Shanette and Latoya. I'm going to share my screen one more time just so y'all can see these ladies' Instagram handles or social media, so that you can be able to keep up to date with them, keep up to what they're doing, make sure to follow them, and continue to encourage each other, continue to be there for one another. Hold on, let me see. I don't think that was the right one. There we go. Okay. Sometimes too many windows. Okay. Continue to be there for each other. And here we go. All right. Okay. Sorry. Some of these. There we go. All right. So please feel free to take a screenshot of this if you can. If not, we'll also drop it in the chat. But these are all the handles for Cheryl, for Jazmine, for Latoya, Shanette, and for Tigerlily. Follow us on social media. We'd love to have you, and we always are empowering and encouraging our advocates and sharing information about our programming, different resources that we have and our partners have. So again, feel free to reach out to us. Have a wonderful and a blessed weekend as we, especially on the West Coast. I'm here in DC as we start moving into the fall and as seasons shift. Maybe continue to have grace with each other and have continue to just be there for one another, be there for ourselves most importantly, and continue to share love and support to one another. So blessings to you all. Have a blessed day. Thank you to our phenomenal panel again, Shanette, Jazmine, and Cheryl, and Latoya, for their vulnerability, for their courage, and for their strength in the midst of it all, to be able to provide information and resources to all of us that are on this call, and for those who will be watching this as we post it on YouTube. Thank you. Have a blessed weekend and take care, everyone. Bye.
Thank you, ladies. Bye.